Ms. Rakidzi Stavroula. Big thanks to Ms. Rakidzi, who is a volunteer psychologist and who has undertaken voluntarily the psychological support program run by the association in the past 2 years with very good results. She's going to present this to you, and we thank her for her volunteering for our patients. I'm the last one, so I'll try to be really, really brief. Volunteering in mental health experts is something that is self-evident. You don't need to thank me. This action is devoted and dedicated to all the members of the association and in memory of little Nicolas. We have stress disorders, depression, and fear of death in cystic fibrosis. Fear of death is not a mental disorder, but rather an existential reaction against something which is really difficult. So all scientists who have come here today before me and psychotherapy aim at reducing your vulnerability and at rendering you much more resilient vis-a-vis stress. The ultimate goal of psychotherapy is recovery and rehabilitation on the basis of the realistic data for each individual. There are two personal viewpoints. The recovery is a result. We measure the efficacy of our therapies, and the recovery as a procedure. You yourselves, you evaluate at all times, on a daily basis, on a monthly basis, on a yearly basis, your own course. And since you are the protagonists and not we scientists are obliged to help you and simply support you in the absence of the state, which does not support the health systems. So since you are the protagonists, I've called upon the members of these teams. I'd like to welcome Marilena here with her son. Stella with her family. Yanis with the entire family. And Miss Athena, a grandmother who urgently came for the conference and who is really in a hurry to leave. So, cognitive behavioral psychotherapy is an effective therapy. There are many studies, and it examines the interaction between feeling, behavior, and thoughts. So we offer a group therapy that consists of 13 weekly 1-hour sessions. We have as a main goal to reduce the stress, to improve the mood, to empower and enhance skills, and we have an introduction into the management of grief. So we want to collect a sample for in the coming years and be able to present to you a much more reliable result. But gradually we start seeing results. So we give questionnaires before and after. The patients group consisted of 14 members. 4 discontinued, 10 continued. The reasons of discontinuation, 3 were stressed, 1 declared that they were going to participate but never came. Group therapy is difficult, particularly when you are to be exposed online. Now, in the carers group, we had 16 members, 10 discontinued. There was a great difficulty by the carers to adjust to the rules of the team and commit for 13 sessions. We'll always be there, available, so those of you who want, you can come. So in fact, we have 6 members who completed and 5 who has sent questionnaires. So therefore, our samples are really small. Regarding the patients group, they have statistically significant results in stress reduction, in their ability to say no and place limits, recovery, and in the ability to do things that fill them with pleasure, as well as in their functionality. It is important in 13 sessions to be able to improve the functionality of patients. Also, it is quite usual for us social scientists to also check the effect sizes. The effect size is about how much psychotherapy has an impact on the several variables, and we have high effect sizes and an overall indicator of effectiveness, total therapy effect 0.57. In the carers group, we have a very small sample. However, we do have statistically significant results vis-a-vis depression and their ability to say no. And the effect sizes, well, moderate to high at all variables, depression, anger, functionality, etc., and total therapy effect 0.48, a very good one. Now, all these above results are correlated with a pilot implementation of 2022 and with international studies. Some of these persons were referred for individual psychotherapy because we are talking about an aggravation for many, the burden being too significant for many people. So then I referred them to the national health system, and these persons presented improvement. The aim of this intervention is training and education in managing a mechanism to deal with the daily life and to reframe life in order to enhance and strengthen individual responsibility, not only vis-a-vis the pharmacotherapy, the diets, etc., but also in the mental strengthening. The disadvantage of this specific year was that there was a big dropout of the carers and there was no comparison with a control group. I myself volunteer, but if we want to have a comparison with a control group, we need to find 2 more psychotherapists, volunteers. So psychotherapy is an indispensable part in the management of cystic fibrosis. We'll go on, and in parallel, I also ask the members, statistical analysis is our own job, and it is an objective data in order for doctors to understand how effective the treatment is. So the pediatricians say, okay, I'll send the parent to a group therapy. But what is also important is the impression of the members. So they told me I can think alternatively, I can be able to manage negative thoughts, I manage stress, anger. I improved empathy. We're not on our own. We are a family. This is the most important thing. If there's something that we stand to gain from these themes, is participation and this feeling of family. You do not feel ashamed to ask for help. You come to the groups, you commit for the sessions, and you ask for help. It is not a shame. Those who are burdened by health problems to have some mental burden. Thank you very much, and I will continue. I'll start with the cares because our dear Miss Athena, our granny, needs immediately. So you have the floor, Miss Athena. Good afternoon. So today I'm standing here. I've heard very optimistic messages from the experts that filled me with hope and relief. Now, we live as a family together with cystic fibrosis that I got to know as a disease with my grandchild who is 2.5 years old today. as soon as we heard about the disease, I had negative feelings, fear, concern, insecurity, stress, all these negative feelings. It was darkness. Misinformation in the social media was horrendous. This was the first access I had. Trying to find some light, I got led to the association. It was a relief because I felt that I belonged to a broader family with the true meaning of the term family. I received messages and they allowed me to see some light. Then the association organized the psychological support sessions in which I stated that I would participate. And indeed, it was really important to get all this help as a mother and such a short notice from coming in contact with this disease. The framework was extremely supportive. Now, I think that this is different from psychological supports on an individual basis with a psychotherapist. I've experienced the group psychotherapy, and this allowed me to share, to listen what other fellow carers had been going through, and this gave me strength and courage. I think that it is really important for us as an association to try to go on with these group therapies because they're really helpful for members. I can vouch for that personally because together with all the therapeutic ways and methods, it's also this part. When you're on your own, we live in the countryside, and it is important for us, and it plays a therapeutic part to be part of such an effort. We do need that, and we thank you for whatever you have offered us so far, and I hope that we'll be able to have it also in the future, and if possible, I hope that it will be reimbursed and be provided by the state if we are to have such a support as carers. Not only for carers, but also for patients and for our own child who is 2.5 years old and still hasn't understood what it suffers from. Miss Athena, just tell us a few words about the future because we don't have time. So others need to speak. Tell us what you think of the future. What I expect from the future is to have our young patient enter the triple combination therapy, to have as many procedures in Greece as possible. What we hear about gene therapy is what fills us with hope and allows us to see some light in the thoughts that come and go all the time. Thank you. Thank you.
Γιάννη, σειρά σου.
Yannis, it's your turn.
Γεια σας.
Good evening. I am John Veloudis. I'm husband to Anna, a cystic fibrosis patient. She's 42 years old. And we are very happy for that because when you talk with someone, people hide years or don't accept the growing older. But in the case of a cystic fibrosis person, things are different. It is something happy. It is a victory to terminate another turn around the sun. But the truth is that nothing is given, and this is true for everybody, not just for patients. 3 years ago, Anna and I were almost permanently residing in Sysmanolio Hospital. Her health was very poor. She had to do IV treatments very often. At that time, there was this revolutionary treatment that freezes the tree catheter. We lived this with many struggles. The Hellenic Association on Cystic Fibrosis managed to bring this drug to Greece, and almost in 1 year, perhaps less, when according to the normal prospects as a new and expensive drug, were 5 or 6 years before it would come to Greece. That was a very big victory. Now, for the association and the struggle, the battle they waged and still wage, we should not forget whom it is comprised of. It is cystic fibrosis patients who work pro bono with a lot of cost for their health and a lot of time dedicated to that. I've always been around the board, and I know nothing is given. And this new treatment helped us to leave the hospital behind and come back to our lives. Anna is going for walks, she's driving a car, she goes traveling, she swims in the summer, and she makes plans for the future. It seems that with the strength of science, cystic fibrosis is beginning to lose ground. I feel confident that it will only become a medical history in the future, a medical history that was healed. Unfortunately, not all of our friends had the opportunity to take the new drug. We will always remember them. We just want to live many years in order to remember them. We will remember them fondly. In concluding, what I'd like us to keep in mind is that with patience, reason, and trust in medicine, everything is possible. Be strong, because the best is yet to come. Thank you.
Συγγνώμη εδώ. Κάτσε. Και επειδή το θαύμα της επιστήμης...
The miracle of science is in front of you. Join the husband of Anna.
Εγώ θέλω να πω ένα μεγάλο...
I'd like to thank Yannis personally, Yannis, John. We went through some difficult times. I wouldn't be alive unless I took this drug. I lived, and many others lived, and John has been next to me from the beginning to the end, and I'd like to thank him.
Κάποιοι από εσάς νιώθετε συγκίνηση.
Some of you feel emotional, but this is cystic fibrosis. There are many feelings involved. And now the floor goes to the patient. I have two historical figures. Stella, the relay goes to you. Stella's artwork is in Gianni Nosocomio. I hope you will always be healthy, Stella. 38 years old. I have been a patient for 36 years. I've gone through many stages. The first stages when it was considered an incurable disease. We were waiting for a drug. My doctor used to tell me it's coming, and it was not coming, and things like that. I didn't have time I didn't have time for the innovative treatments when they came around. When I was 18 years old, I had my first transplant in 2006. It didn't go well. I did a second transplant in 2014. Luckily, I am in a very good condition now. I can do things. I can do the things that I wasn't able to do when I was worse in the past. I am now studying, I can keep fit. I feel very different now. Of course, transplant is not a panacea. It opens new doors, it opens new horizons, but the problems are many and you have to be monitored. I can say that we are countering statistics which speak about 10 years of life expectancy. It is much more. I am transplanted since 2006. I'm 40 years old now, and I have more time in front of me. The question is, you need to have a will to live. But this is true even for those who are not patients. Everybody needs to be optimistic. We should not give up. Nobody should give up. Everybody should fight for the best, do things for themselves. My psychotherapy with Mrs. Rakidji was very helpful. She taught us to claim things that when I was in a poor condition, I didn't have the strength to claim, to fight for. I wasn't feeling self-confident. I wasn't believing in myself. I didn't have any self-esteem. This is a problem that you often find. In general, the association all these years has done a very constructive journey with the patients themselves. I believe that in Greece there are many things that can become better, a better organization with doctors, with centers, a better structured situation to avoid going from one doctor to the other and have everything put together at one place, and hopefully to have a treatment that will be appropriate for us who transplanted, to solve not only the respiratory problems but also the pancreatic problems and all the rest. Because in essence, we don't have only the cystic fibrosis problems, but we have the problems that are due to the transplant medication. Thank you.
Marilena, it's to you to whom we pass the torch. Good afternoon, everyone. A big thanks to our Stavroula, who psychologically supports us with her ever present interest, with many thanks to the doctors and to the nurses. Let me say a few words about me. My name is Marilena. I'm 56 years old and more, and I feel like all those women who many years ago had a predefined future, where their parents would oblige them to marry someone. So this is how I saw cystic fibrosis. But to me, this was not a yoke, but rather a partner. I wasn't suppressed by it and oppressed, and it gave me incentives to do things that a patient with cystic fibrosis would never do. Most of the things I wanted to do have been done. There are other things in the list to keep on having incentives for the future. But what I want to say is that I had definitely been through many obstacles in my life, which I overcame thanks to my courage and stamina. I saw them as a challenge. I'd like to share with everyone that you need to look at the future with optimism, claim your rights, and do away with the selfishness. This is really erosive. I have nothing else to say. Keep the faith, have trust in yourself. Most things can become true and a reality. And I'd also like to call upon my son as proof that things can happen. It can become a reality. He's 27 years old, so everything can happen. Anything can happen. Concluding, I'd like to thank you. These four people said just one thing. The best way to deal with the fear of death is action for life. We all die. We all are born and die. We can't get away from death. But for some people, death is more specific. With the new treatments, cystic fibrosis, in cystic fibrosis, life is extended. So keep on living, keep on demonstrating this strength for life. Be well. Now, I saw that Marilena, Stella, etc. Marilena was the first patient in Greece, a patient with cystic fibrosis who became a mother, and she was the first president in our association. It was back then, in 2000, the first time that we had adult patients in the board of the association. We've been through Stella. Stella has a first here. She is the first female patient in Greece who has undergone 2 lung transplants, and she's amongst us. She will continue to be amongst us for many, many years. I'd like to thank Stavroula Rakinzi for everything that she has offered. Indeed, we really needed the psychological support because we had left this behind. We were dealing with the medications, the treatment, etc. And we would forget about the basis of everything, mental health. Where are we to go with our mental health? So this was a big offer by Stavroula, and we're really glad that we're going to continue next year. And let me announce it that we are going to continue as of January. We'll have our new groups, carers and patients as of January. So very soon you get the news as to when we will start so that you can all participate and enjoy this big gift by Ms. Rakinzi. Konstantina, would you like to say something? I don't know, I'm really touched. I'm really emotional. There's always hope. This is what we keep. And all the testimonials of our friends show exactly this, that there's always hope, that anything can be done. And I will wish us all health. And a big thanks to my mother and my father for all these things that they have done for us. we will conclude with this session. Thank you very much, Ms. Anagnostou, for having come from Thessaloniki next to us. I think that many of us patients will come to you, and we will have you next time. Ms. Rakidzi, thank you warmly for having come here, supporting our association. We thank the patients and the carers.